Okay, good morning, everybody. Thank you for being here. We have some other people on the way in, but we're going to start just to keep everybody on schedule. I also just want you to know we have about 1,000 people on digital, so they're streaming to about 1,000 people as well. So I want to say welcome to all of those on. And for everybody here, a special welcome. My name is Mike Dowling. I'm the president and the CEO of Northwell Health. And it's an absolute pleasure to be able to sponsor the 7th Constellation Forum like this. This is our 7th one. Many of you have been here at previous ones. It's been an exciting opportunity for a variety of people from various disciplines: medicine, technology, education, engineering, healthcare systems, etc., to be able to come together and discuss new ideas, discuss where we are, where we've come from, and what we need to be doing going forward. So it's an absolutely exceptional time. And if you look at the theme, healthcare in a world of change, which some people look at something like that and they're a little bit fearful of change, but those of us in this room, we welcome change. We know that if you're not changing, you are falling behind. And if you're going to progress, you got to look forward, not just only backward. You look backward to learn, but you use what you learn to be able to decide what it is you've got to be doing going forward. And so this is an opportunity for everybody to collaborate, share information, learn from one another, partner with one another, and take the advantage to break down silos, take the advantage to come together to figure out how we can combine our assets and our talents so that we can continue to provide better care in the future, so that at the end of the day, people who are in the bedside have better treatments, get the benefit of new discoveries. And as was discussed at a dinner some of us had last night, was also to be developing those treatments and those technologies to prevent illness in the first place, so that we have less to treat at the end and spend more time figuring out how to deal with it up front. And we're at a special point in history with all of the new technology, especially AI, etc. And I think we're going through an experimental period, and will for many, many years, as to how to actually take advantage of all the new technologies, how to make sure that we can use them to their maximum capabilities, but also make sure that we are very, very careful that we don't allow things to happen that shouldn't happen. And that as we use technology more and more, we never lose sight of the human element in healthcare delivery. And these can be somewhat challenging, but again, every challenge is an opportunity. It's also an opportunity for us to build trust in science. As everybody, and most people, I would say everybody in this room, is very familiar with the growing distrust of science that has occurred over the last number of years. Didn't begin at COVID, but it was accelerated during COVID. And that's unfortunate, because when there is distrust of the truth, and distrust of science, and distrust of the benefits of new discovery, we obviously are retarding the ability to use those developments to improve care in the long run. And so I think that's a challenge for us, and that requires leadership, positive leadership, leadership that has courage, that is willing to stand up and discuss those issues that we hear about publicly, especially these days, that requires a counter argument. And so I think that there are people in this room that obviously have been doing this and are willing to do this going forward. So we have to break down that distrust. Truth matters. Honesty matters, decency matters, integrity matters, trust matters. As people would recognize that, progress moves at the speed of trust. If there isn't trust in information, if there isn't trust in logic, if there isn't trust in reasonable discovery, then we all suffer. Not just only in the healthcare world, but in the generic world overall. And that, I think, is an opportunity and a challenge for all of us. So my job is just to say welcome. Thank you all for being here. I want to thank the speakers, the people who are on panels. I know everybody is very, very busy, so I know you've taken time out of your busy schedules to be here, and we appreciate that. But I believe everybody at the end of the day will find that this was a worthwhile experience because we will share and learn from one another. And I also want to say to close, I want to thank all of the staff that have worked tirelessly to put an event like this together. Landmark Ventures, I want to congratulate. I want to congratulate our own staff at Northwell, the marketing department, and everybody else. And again, welcome. And with that, let me turn it over to the person who will MC today, and that's Jill Coleman, Dr. Jill Coleman, who is the Chief Medical Officer for Northwell Health. So I'll have Jill come up, and then my role, which is easy, is to say welcome, have a good time, enjoy, appreciate the talents of each other, and appreciate the opinions of each other. So with that, Jill, thank you so much.